From the perspective of my role here at the university, there are two areas where I look at sex and gender differences. One is as a clinician, and that really is, how do I treat my patients? What type of diseases are they most likely to present with based on those differences? And what is the best therapeutic for them based on those differences? Many of those are not just going to be based on sex and the pharmacokinetics and the biology, but also on the gender. So what are the most acceptable levels and components of care that the patient is going to be willing to accept based on these cultural differences that are often associated with gender? But as the executive director for the Center for Medical Innovation, we also look at sex and gender differences as we're developing new devices. Interestingly, most people don't think about the differences in the end user. So based on sex and gender, many of our female end users or physicians and surgeons have a difficult time using some of the common devices that have been designed for men. So surgically, when we use a surgical stapler, it's very common for women who tend to have smaller frames and smaller hands to have to let go of an instrument and use two hands to be able to squeeze the stapler and actually make it fire and deploy the staples, whereas men can very commonly use one and be able to use their other hand as a retractor. This is a problem, and what we found is most devices are designed for the male user. We need to start focusing the development of devices to fit the needs of both users and not just the males, as it seems to be traditionally done.